Hello, and welcome to HSS Florida. This is Dr. John Patrick Connors. I am a hip and knee replacement surgeon with the Adult Reconstruction and Joint Replacement Service at the Hospital for Special Surgery. We are honored that you have entrusted us with your orthopedic care. Thank you for your time and attention over the next few minutes as we review some important information prior to your knee replacement. Over the next 20 minutes, we will review important information regarding knee replacement surgery, planning and preparing for surgery, the day of your procedure at the Ambulatory Surgery Center in West Palm Beach, as well as what to expect at home after your operation. This video is intended to provide a basic guide of your experience and is not intended to replace direct discussion with your surgeon. The normal knee is a complex hinge joint between the bottom of your femur bone and the top of your tibia bone. There is a secondary articulation between your femur bone and your kneecap, also known as your patella bone. The cartilage that covers the ends of these bones acts as a cushion to allow your knee to move freely and without pain. Due to a combination of factors, typically related to aging, your particular genetic profile, and potentially a prior injury to your knee, the cartilage coverings of your femur, tibia, and patella bones can begin to break down prematurely. This leads to inflammation in the joint, and ultimately the roughened bone ends rubbing against each other. This is what is known as arthritis. Patients typically feel this as pain deep in the knee, thigh, and even hip, particularly with activity. They also feel stiffness, reduced range of motion, and instability or giving way of the knee. If after an extended course of conservative treatment, you continue to have pain and dysfunction related to your knee arthritis, knee replacement is a good option to reduce pain and improve function. Knee replacement removes the diseased arthritic bone ends and replaces them with new metal and plastic parts that act as your new knee. A knee replacement is composed of 4 component parts. Like putting a crown on a tooth, approximately 1 centimeter of arthritic cartilage and diseased bone is removed from the ends of the femur and the tibia bone and replaced with a cobalt chromium or hardened titanium femur and tibial components. The specific amount of bone and the orientation of the bone removed is customized for you based off your individual anatomy, ligament tension, and postoperative goals. The implants are held in place in one of 2 ways. The gold standard for knee replacements is the use of a highly specialized bone cement called polymethyl methacrylate, or PMMA cement. Rather than acting as a glue, this cement acts as a grout and interdigitates with the bone structure around your implants, holding the parts in place. This has an excellent long-term track record. For younger patients or patients with harder bone that will not allow for cement to interdigitate, highly porous implants can be used, where the tibia and the femur components are wedged into place, and the bones see these implants as self, and the femur and the tibia bone incorporates into the implants. Between the implants snaps a specialized plastic liner. This acts as your new cartilage. Additionally, if your kneecap cartilage is worn, this worn cartilage will be replaced with a plastic button on the undersurface of the kneecap. The design, size, and orientation of these parts are chosen specifically for you based on your individualized needs, pre-surgery condition, and goals after surgery. The purpose of performing a knee replacement is twofold. It is to reduce the pain you are experiencing and get you back doing the things that you love. This is a successful operation, with more than 80% of patients undergoing knee replacement surgery at HSS satisfied with their operation. Despite being an excellent operation, like anything else in life, there is no free lunch, and nothing is without risks. We believe it is important that you understand these risks before proceeding with surgery. Specific to a knee replacement, the most common risks are infection, blood clots, stiffness, and incomplete pain relief. Later in this video, we will review our specific pre- and postoperative protocols to minimize the risk of these events. We will also review these risks as well as your specific individual risk profile at your 1-week preoperative visit. While successful knee replacement has been performed for many years with the use of manual instrumentation, for select patients, I will recommend the use of robotic or navigation-based technologies during your knee replacement. The use of robotics allows me as a surgeon to be more precise, which is most important for patients who would benefit from alternative alignment philosophies. Whether your knee replacement uses robotics, navigation, or precision instrumentation with intraoperative kinetic balancing tools, your knee replacement will be individualized and customized specifically for you based on your preoperative alignment, function, bony morphology, ligament tension, and postoperative goals. If knee replacement is something you are interested in proceeding with, there are a number of tasks that you will need to complete prior to surgery. First, you will need to see your medical doctor and any applicable specialists, such as a cardiologist, to ensure you are healthy enough to undergo surgery. They will order routine blood work and an EKG. I also ask that you see the dentist prior to surgery for a clean bill of dental health, as I would request that you do not have any dental work for 3 months after your knee replacement to minimize the risk of infection. These clearances will need to be sent to our office at least 2 weeks prior to your operation, and I recommend that you call to get in with your primary physician, cardiologist, and dentist as soon as possible once you have picked out a date for surgery. Next, you will need to prepare your team and your home for surgery. Knee replacement recovery is a team sport, and you cannot do this alone. You will need somebody to pick you up and drive you home from surgery, and I ask that you have somebody stay with you around the clock for at least the first 72 hours after surgery. After that, you may stay on your own, but most patients will need some help around the house with things like cooking and cleaning for at least the first 2 to 3 weeks after their operation. Through your insurance, my team will coordinate a nurse and a therapist that comes to your house twice a week for the first 2 weeks to check on you. These are not full-time caregivers. Most commercial insurances, particularly Medicare, do not cover full-time caregivers or rehab center stays after knee replacement. It is important you discuss your benefits with your particular insurance carrier to understand what will be covered and what will require copay, coinsurance, or out-of-pocket costs. You will also want to prepare your home for surgery, organizing frequently used items nearby, such as phone chargers, removing anything from the ground that may be a tripping hazard, and making a recovery plan for any pets you may have at home. Next, there are several pieces of equipment that you will need to gather. In your pre-surgery packet, I have provided you with a prescription for a walker. You will need this for the first few days to week after surgery. You can obtain these from a local durable medical equipment supplier if you would like to use your insurance, or alternatively, these can be purchased out of pocket from a store like Amazon or Home Depot for approximately $60. In your pre-surgery packet, I have also provided you with specific instructions for skin and nose cleaning prior to surgery. I ask that you obtain these specific items as soon as possible, as you will need to begin using them starting 5 days before your operation. Finally, many patients choose to use additional equipment such as an ice machine, shower chair, or raised toilet seat to help with their recovery. While not typically covered by insurance, I have partnered with a third-party vendor known as the Recovery Shop to help facilitate you obtaining these helpful items prior to your surgery. You have received a QR code in your surgery packet, as well as a direct link that will be included in the email containing this video. Next, I ask that you prepare yourself for surgery, and I believe the importance of this slide cannot be overlooked. I ask that around the time of your operation, you treat yourself like an athlete. If you are smoking, I ask that you stop smoking 6 weeks before and 6 weeks after surgery to minimize the risk of infection. I would ask that you participate in your pre-surgical exercise program, as well as attend your preoperative physical therapy visits with our HSS physical therapists. Furthermore, I ask that you focus on your diet, eating high-quality, high-protein foods, as well as whole grains and colorful fruits and veggies, as eating a healthy diet has been shown to make a substantial difference in your recovery after surgery. iovera, the brand name for genicular nerve cryoneurolysis, is an innovative tool in the fight against postoperative pain after knee replacement. performed within 30 days of your surgery. There is promising data to suggest a reduction in pain and narcotic consumption for the first 3 to 6 months after surgery. As such, I recommend all of my patients undergoing knee replacement to have this procedure prior to their surgery, and this is typically covered by your insurance carrier. This will be coordinated through our office in conjunction with LB Bettridge, PAC, who is our iovera expert here at HSS Florida. 2 weeks before your operation, you will have a phone call with one of our nurse navigators. They will review your medical clearances as well as your full medication list, including what medications to stop and when. It is vitally important that you follow their instructions, as failure to do so may result in your surgery being canceled. While these specifics will be reviewed in detail at your 2-week preoperative phone call with the nurse navigators, as a general rule, I ask that you stop anti-inflammatory medications at least 10 days prior to surgery and any blood thinning medications at the very least 5 to 7 days before your surgery, though this will be ultimately at the discretion of the physician who prescribes these medications. Additionally, it is critically important that all medications are listed on your medication list. If you take a biologic drug or chemotherapy that is not found on your medication list, please tell your nurse navigator or call my office to review these medications together. 1 week prior to surgery, we will meet together to review your clearances, your consent form, and answer any last questions that you may have about surgery. I will then send your postoperative medications after this visit. I ask that you fill these as soon as possible so that you have them available for you after your surgery. Finally, I ask that you hydrate with a carbohydrate-rich sports drink before your surgery, as this has been shown to improve your recovery from anesthesia as well as surgery itself. This is as simple as a full sugar Gatorade the night before and the morning of surgery at least 2 to 3 hours prior to your surgery start time. It is important that you do not eat anything after midnight the night before your procedure. While you may have black coffee in the morning of surgery at least 2 to 3 hours prior to your surgery start time, please do not put any milk or cream into this. A patient's surgery is canceled at least once a month over coffee creamer. Please do not let this happen to you. The day of surgery is an exciting and nerve-wracking time for patients and caregivers alike. It is quite normal to be both excited and nervous the night before and the morning of your surgery. Your surgery will be performed at the HSS Ambulatory Surgical Center in West Palm Beach. The facility is located on the 4th floor of our main office building at the 300 Palm Beach Lakes Boulevard location. You will enter on the 1st floor, check in, and will be directed to the patient elevator that will take you up to the 4th floor. Included on this slide is a QR code linking directly to Google Maps from your current location. You may want to use this the night before surgery, so you have directions planned ahead of time. It is important that you arrive on or before your scheduled arrival time. Once you have checked in on the 4th floor, your caregiver will wait in the waiting room while you are brought back to the preoperative area. Here, you will change into a surgical gown and have an intravenous line placed for medications. I will see you before the operation to complete some last-minute paperwork, and you will meet with our wonderful anesthesia team to review your individualized plan for anesthesia. This typically includes a spinal anesthetic so that you are numb from the waist down during the operation, as well as a nerve block that lasts between 24 to 36 hours after surgery. You will have some light sedation, but minimizing the amount of general anesthesia that you need during the operation. When it is time for surgery, you will be brought back to the operating room. There are lots of people and lots of activity going on, but all is focused on helping you. After your anesthetic medications are given, you will be positioned on a table specifically designed for knee replacement surgery. The surgery itself takes me about 45 minutes to an hour, and from the time you enter the room to the time that you return to the recovery room typically takes about 2 hours. In the recovery room,
Your nurse will monitor you as you wake from anesthesia. Once you are able to, he or she will teach you how to walk with your walker and get you in and out of bed. Once you are comfortable, you'll be discharged home. This is on average about 4 to 5 hours after arrival to the surgery center.
After discharge, while the hardest work for me is over, the hard work for you is just beginning. The first few weeks of recovery after a knee replacement can be quite challenging. Over the next few slides, we will review your experience at home to make your recovery as easy and as seamless as possible.
At home, I want you to take it easy for the first 2 weeks. I expect pain, swelling, and bruising, particularly worse on days 2, 3, and 4. Icing and elevating as much as you can help keep the swelling down. Take your activities slow for the first 2 weeks and follow the instructions of your home therapist. I find patients who overdo it in the first 2 weeks actually tend to slow their recovery down due to their increased swelling.
Despite the number of different ways that we have to control pain before, during, and after surgery, there are no two ways around it. Knee replacement recovery is painful. I expect you to have pain after your operation. Ice, elevation, and relaxation are all excellent ways to help with the pain over the first few weeks. You will have a number of different pain medications prescribed for you, and I expect that you will need them for at least the first few days to few weeks after your surgery.
Ice and elevation are highly important and often underutilized means of controlling pain and swelling after surgery. In the first 2 weeks, there is no amount of icing or elevating that I would consider too much. When you are elevating, it is important that you elevate your operative limb higher than the level of your heart. This means putting your toes above your nose. If you notice swelling in your knee, ankle, or foot, you are not elevating enough. Nausea can be quite common in the first few days after surgery. Please follow these tips, particularly eating small, dry, bland meals for the first several days. Included are a list of foods that can help with nausea, including dry toast, crackers, pretzels, or applesauce.
Constipation can also be quite common following a knee replacement, particularly when you are taking narcotic pain medications. Make sure you are drinking enough water, and be sure to take your stool softeners as prescribed to prevent constipation while you are on narcotic pain medicines. If you are having a hard time going, over-the-counter Miralax, prune juice, or simply black coffee can be good options to help you go. A deep vein thrombosis, or DVT, is a rare but potentially dangerous complication after orthopedic surgery, particularly after hip and knee replacement. You will be prescribed DVT prophylaxis medication prior to your surgery. This will be based off your individualized risk profile for clotting. It is important that you inform our office of any personal or family history of blood clots, hormone replacement therapy use, or active cancers prior to your surgery, as these can all increase your risk for blood clots. It is vital that you understand how and when to take your DVT prophylaxis medications, and you should not be discharged home until you understand this. At home, I ask that you take frequent short walks and perform your ankle pumps when icing and elevating to improve your circulation. Please do not hesitate to call our office if you have concern for a blood clot. Next, regarding your surgical dressing. You will be discharged from the surgery center with a soft padding and ACE-wrap compressive dressing over your knee. This may be removed the morning after your surgery. Underneath, you will find a waterproof bandage, and you can shower with this on right away. Please make sure this waterproof bandage stays clean and dry. If it becomes soiled or wet, you may change it with the help of your home health nurse. You will remove your waterproof dressing on day 7 after your operation. Underneath, you will find a silk bandage. Please leave this on. This will fall off on its own, typically around 3 to 4 weeks. You may leave this silk bandage open to air, and you can shower with this on. You do not need any additional waterproof coverings for any of your dressings.
Finally, if you have any questions or concerns after your operation, please do not hesitate to call our office. There will be lots of people checking in on you after surgery, including the home health nurse and myself the day after surgery, as well as your nurse navigator in the following days. Please do not hesitate to reach out to us if there are any questions or issues.
Thank you for your time and attention to these important details. I look forward to providing you with the highest quality orthopedic care. Please do not hesitate to reach out to my office with any questions or concerns regarding your knee replacement. I look forward to seeing you at your 1-week preoperative visit. Thank you.